My name is Michael Battelle, and I'm the president and founder of the Fatty Liver Alliance. We raise awareness about the risks, causes, and complications of fatty liver disease and help those already diagnosed with MASLD and MASH by advocating for access to approved treatments and care. Today, in part 7 of our 10-part series, we will be discussing realistic approaches to diet for liver health. Our expert, who I will introduce in a few seconds, will offer insights and practical tips for eating well without needing an overly restrictive diet, making it manageable for patients at any stage of liver disease. To help us really understand this part of the patient journey, I'm honored to introduce my very good friend, Professor Shira Zelber-Sagi, who's a clinical dietitian, epidemiologist, and researcher from Tel Aviv, Israel, and she's a recognized global expert on MASLD and MASH. She's also the chair of the EASL Public Health Committee. Shira, are lifestyle changes so important for our health? And why do these healthier food and lifestyle changes that we can stick with, I know that's a key part of it, why do they have to be so hard for people?
So first of all, I'm very happy to be here, Mike, and I follow your activities, especially the ones with relation to diet and encouraging healthy diets, and I really appreciate all your activities. It's a pleasure to be here today. So first of all, we know how important diets are for our liver health. And if you don't take care of your liver, it doesn't take care of you, right? And the way to take care of it is by healthy lifestyle. However, we live in a very difficult environment that doesn't encourage healthy eating or physical activity. We have so many temptations. We call it obesogenic environment. So there are so many, ultra processed foods, tempting, low price, ready to eat. You don't have to invest a lot of time in preparing them. And on the other hand, we ask our patients to have a healthy diet, which is much more expensive, which you need to bother and cook the food, and you don't just grab it and go. And it's really challenging to do all these changes when you have your own old habits and when you have such a difficult environment that is really unfriendly to a healthy diet. So it is difficult, but it's not impossible. And it's definitely worth the effort. Definitely worth the effort, because the most important thing we can do to prevent liver disease and to treat liver disease is diet. Can I share some slides with you?
Of course, I think that'd be really great. Thank you.
Okay. So let me tell you a little bit about what are the diet principles that we want to achieve. Let me just go a little bit backwards. Okay. So I want to present a couple of minutes of my tips of how to prevent and treat metabolic dysfunction associated steatotic liver disease. So first of all, we can talk about prevention and treatment as the main treatment of MASLD. And even in the recent EASL guidelines published in 2024, the European Association for the Study of the Liver, there is a question whether diet can prevent and treat MASLD. And the answer is yes. In the general population and in certain population, you can treat MASLD even without medications, just by changing the diet, and you can improve significantly all the features of MASLD, meaning steatosis, which is liver fat, inflammation and fibrosis, and even prevent, and this is really important, liver cancer by appropriate healthy diet and lifestyle. So every time we treat MASLD or prevent MASLD, we also prevent liver cancer. It's something that we all should keep in mind. And when we talk about lifestyle, there are many components of lifestyle. So we talk about weight reduction, of course, but we need to remember that there are other things about our lifestyle that affect dramatically the health of our liver. So for example, a neglected topic is smoking. I mean, do you know that smoking increases the severity of liver disease, increases fibrosis, and significantly increases the risk for liver cancer? So we need to try to avoid smoking. Also, we need to talk about the quality of the diet. For example, high sugar food and especially highly sugared beverages. If we consume it on a daily basis, it is really harmful for all aspects of liver disease. Red meat, red and processed meat, is also harmful, and there are many studies showing that if you overeat red meat, and especially processed meat, like sausages, for example, then you have a higher risk for liver damage. So we need to remember that it's not all about weight reduction, and there is a lot of importance to other habits, like the quality of the diet, the dietary composition, and other habits like smoking, and of course, physical activity. And just to show you one example of the association between diet and liver cancer, there are many studies showing an association between unhealthy diet and increased risk of liver cancer. On the other hand, there are studies showing that if you have a healthy diet, like Mediterranean diet and a lot of fruits and vegetables and fish, you can reduce the risk of liver cancer. So this is just one recent example of a very large study among women, showing that if you drink sugar beverages, if you can look on the figure on the left, sugar beverages, at least one serving per day, you have 68% increased risk of having liver disease mortality. And moving to the figure on the right, if you have at least one sugar beverages per day, you have 85% increased risk of having liver cancer. So keep in mind, it's not only about the liver fat, it's way beyond that. It's very serious clinical outcomes that are related to the consumption of sugar beverages and healthy diet in general. And when we look at the guidelines of the medical association, the big and important medical association in recent years. So we have here the American guidelines, we have the ISO guidelines, which is the European Association for the Study of Liver Disease, Diabetes and Obesity, and we have the ESPEN, the European guidelines. We can see that there is a very amazing agreement between all these guidelines of what are the lifestyle recommendations for patients with MASLD. So they all agree that we should have a weight reduction of at least 5% to reduce liver fat, and if we have to reduce inflammation and fibrosis, we will try to reach 7 to 10% weight reduction from the initial body weight. But as I mentioned in the beginning, it's also about the dietary pattern, the quality of food that we eat. So you can see here there is also agreement between the guidelines. They all agree to have Mediterranean diet, a lot of olive oil, fruits, vegetables, fish, legumes, high fiber carbohydrates, poultry, low fat, dairy products, walnuts, and to have low consumption of sugar and saturated fat and red and processed meat. This is the Mediterranean diet. It summarizes everything we need to know about a healthy diet. And they all the guidelines recommend reduction of saturated fat and reduction of sugar. They also recommend in the ISL a reduction of ultra-processed food, highly industrialized food, undergoing a lot of industrial processing, which usually contains a lot of saturated fat and sugar. Then we move to physical activity, and of course all associations recommend increased physical activity, about 150 minutes per week of moderate physical activity according to the abilities of the patients, of course. And they also recommend resistance training, which is more helpful for increasing or maintaining muscle mass, at least twice a week. Coffee is recommended by some of the associations. It can help in prevention of fibrosis and liver cancer. Don't drink too much coffee, and definitely without sugar, but 2 or 3 cups per day can be helpful for some patients. Now, how to reduce weight? This is the big question. Which diet should we do to reduce weight? And my answer is every diet that you feel good with and you can keep in the long term. The patient has to choose his own diet. Of course, with health professional, with a dietitian, with a physician. There are different types of diet: low fat, low carb, Mediterranean, ketogenic, time restricted eating, where you eat only in a certain amount of hours per day, like 6 or 8 hours per day. There's an eating window, and the rest of the day you don't eat. This is time restricted eating. You need to discuss it with the patient and find the right diet tailored to the patient's needs and abilities. And whatever diet you do, as long as it is healthy in general, it doesn't contain a lot of sugar, processed meat, saturated fat, as long as it is generally healthy, it could be good for the patient. So, and you can also combine between the diet. Where you can look at the figure here with the circles. This is a conceptual model showing that you can combine the different diet. You can have a Mediterranean diet, which is also low carb. You can have low fat diet, which is also Mediterranean. And you can have intermittent fasting, like eating for restricted hours per day in every type of each of those diets. So don't forget that you can tailor your own diet. As long as you can keep it and you feel good, this is what is important. This is an example for a long study, 12 months clinical trial, comparing regular low-calorie diet to intermittent fasting diet. In the intermittent fasting diet, they ate only for 8 hours per day. And you can see that the reduction of liver fat was similar, and the reduction of liver stiffness as a marker of liver fibrosis was similar, meaning that if you reduce calories and have generally a healthy diet, it doesn't matter if you do intermittent fasting or not. What is the benefit of intermittent fasting? It depends on you. If you feel good to stop eating at 4 in the afternoon and not to eat anything until the next day, then it's great. If it helps you to keep the diet, then it's great. If you feel it's extremely difficult for you, don't do it. Just reduce the calories. It will have the same benefit. And this is a summary of the different diet, the most familiar types of diet. So Mediterranean diet is the most evidence-based diet, and it has very evidence-based outcomes of improvement of liver health and reduction of all features of fatty liver disease or MASLD. The problem with it is the prices of the foods. So sometimes it's an expensive diet and it's not easy for everyone to eat fish, for example, 3 times a week, or use only olive oil because it's more expensive than unhealthy oils. There is the ketogenic diet. I don't recommend it because it's very restrictive. It's very difficult. The studies are usually short-term, less than 3 months. But if you do want to have this diet, it's possible. Just do it with a professional advice. Just do it with a professional advice and follow up, because there could be some concerns about this diet, like too high intake of saturated fat, which is not good for people with MASLD. There could be some micronutrient deficiencies. So if you do decide to go for this diet, although it's not very much evidence-based in MASLD, just do it with a supervised treatment or supervision of a dietitian. And then there is the intermittent fasting that I already mentioned, and which could be really great. There are more and more studies using this diet, and it seems beneficial, but not necessarily more beneficial than a regular low-calorie diet. So it could be good for many people, but people with advanced liver disease, people with cirrhosis, should not do it, because people with cirrhosis should avoid fasting, a long fasting time. It's not good for them. It's catabolic for the muscles. So people with cirrhosis should know not to do intermittent fasting. And I mentioned ultra-processed food earlier. You can see figures of ultra-processed food, the burger, the colored cereals, sugar beverages, sausages. These are examples for ultra-processed food. And below you can see examples of unprocessed food or minimally processed foods, which are more healthy for people with MASLD, more like fresh foods. And generally, this study shows that there is repeatedly association between high consumption of ultra-processed food and MASLD, metabolic syndrome, meaning obesity, hypertension, type 2 diabetes. So generally, for liver health and for general health, if we want to prevent cardiovascular disease and type 2 diabetes, we should keep the consumption of ultra-processed food low as much as possible. And here you can see a study showing a dose-response association between how much ultra-processed food you consume in your diet and your risk of having muscle. So you can see the slope is very clear. The more ultra-processed food you eat, the more you have a risk of muscle. I mentioned meat earlier, red meat and processed meat, and I said try to avoid it as much as possible, especially processed meat. So there is always the question, should we all become vegetarian or even vegan? Is this the right choice? So you don't have to become vegetarian and definitely not vegan unless you want to, but you would benefit from minimizing the consumption of red meat and eliminating the consumption of processed meat. You can have fish, you can have poultry, you can have eggs, you can have low-fat dairy products, so you don't have to become vegan. That's for sure, unless, of course, you want it. But if you do decide to become vegetarian and you do a diet for muscle, you need to do it in the right way. Because sometimes patients say, okay, I became vegetarian, and what do you eat for lunch? I eat rice and potatoes and some bread. Okay, so you eat carbs with carbs with carbs. Where is the protein coming from? There's no protein. And it is really important in the diet of muscle to have sufficient amount of protein, because many times people have sarcopenic obesity. They have overweight, but have low muscle mass, and they should have appropriate amount of protein in their diet. So if you do decide to become vegetarian, you need to keep the protein up and the carbs down. Make sure you don't miss this point. And in this study, you can see that if you have a healthy vegetarian diet, like plant foods, you have fruits, vegetables, nuts, legumes, whole grain foods. In the green lines, you see reduction in the risk of muscle. But if you have unhealthy plant foods like refined grains, potatoes, sweet desserts, and sugar beverages, you don't gain anything from becoming vegetarian, and you have the same risk for muscle as people who eat a lot of meat. So if you do decide to be vegetarian, do it in the right way. And this is just a paper emphasizing again the importance of sufficient amount of protein in the diet of people with muscle. Okay, this is really important to remember. And this is a study we published so far. I mentioned low-fat dairy products. So in this study, we showed that if you have low-fat dairy products, you have reduced risk of having muscle. And if you have high-fat dairy products with a lot of saturated fat, then you have increased risk of having muscle. So if you have dairy products as a source, a very good source of protein in the diet, just keep it low fat. Low fat is around 5% fat. And I mentioned lifestyle. So this is a study we published recently showing that if you keep a healthy lifestyle in general, it gives you a score on a general healthy lifestyle. You can see that if you don't smoke, have a healthy diet and a healthy weight, do physical activity, you have significantly reduced risk of having muscle. You can see the slope in the figure. So the more you keep a healthy lifestyle, the more you have reduced risk of having muscle. Moreover, we ask people how they eat. Do you eat while standing? Do you eat when you're nervous? Do you eat between meals? And we gave them a score for eating behavior. And what we have shown that if you have unhealthy eating behavior, you have higher risk of muscle. So it's not only what we eat, it's also how we eat. We should eat properly. And we are almost finalizing. We need a holistic approach. We need to increase awareness among patients and physicians about the importance of diet. We need to have multidisciplinary care. We need to have public health policies to support our patients to have a healthy diet. As I said, we live in an obesogenic environment, so we need taxes on sugar beverages. We need the prices of healthy foods to be affordable to everyone. Fruits and vegetables, for example, should be affordable to everyone. And we can sometimes use some web-based approaches also. Could be helpful to some patients, but not for everyone. And it doesn't replace also health professionals. And now there are medications, and everybody is looking for a medication to treat their liver disease. It's really tempting. And it's great that we have medications. But always remember, in the base of the treatment, it's lifestyle. Always. That never goes away. Even if you take a medication for weight reduction, for example, always you have to keep a healthy lifestyle to keep your liver healthy. And finally, this is the algorithm published in the EASL guidelines, which is pretty amazing. I'm not going to go over all of it, but it emphasizes and summarizes my entire talk. And it says that people with MASLD who have obesity, and even those with normal weight, should keep a healthy diet, should reduce the weight, even a little bit reduction. For people with normal weight, they can reduce a few kilograms and they will see improvements in their liver disease. They all should keep a high quality diet, physical activity, and it doesn't only reduce steatosis, it can also prevent liver cancer and advanced liver disease, type 2 diabetes, cardiovascular disease, and most importantly, improve their quality of life. And with that, I would end my presentation. Thank you, Mike.
Shira, that was incredible. And if you can go back to the full screen, that would be great. And then we can, there we go. Thank you. I like to see you. So you shared so much. I am sure that people that are interested in this topic are going to have to watch that 2 or 3 times because every section that you discussed is helpful. And I had a bunch of questions. Some of them you answered. I have a couple things I wanted to just dive into, if that's okay as well. So my first question is, okay, you convinced me with all the data. Where do I start? I haven't been very good. I'm not talking about me because I actually learned my lesson. But for people that want to start and maybe they're afraid to take that first step, what do they do?
First of all, get help, take advice from professionals. Some people say, I know everything I have to know about diet. And I believe them because they studied and they read a lot and they have experience. But we all need support. We all need some guidance and we all need support. So try and get some support from health professionals, especially dietitians. But then try to think, what is the easiest way to start? What is the easiest thing I can do? Can I, for example, it's very difficult for me to stay hungry. It's very difficult for me if you tell me to eat less. It's a challenge I can't keep in the long term. But if you tell me I can reduce sugar beverages by half at the beginning, maybe that's something I can start with. So I always say, what is the easiest thing you can start with? Do that for a month, and then we will discuss the next step. Let me know
Okay.
how you feel, and then we discuss the next step. Step
It's
by
funny.
step.
Yeah, it's funny you said the juices. I know things like orange juice. We were a lot of us were brought up on saying, hey, why don't you start your breakfast with a fresh squeezed orange juice or whatever? And it's like one of the worst things, right?
It's well, there
The
are
sugar.
worse things
From
like
the sugar
the
perspective.
sugared soda, I would
Yeah,
say,
yeah.
because also it
Okay.
doesn't contain any vitamins. So there are even worse things, but it's
Okay.
definitely not good for people with muscle because it contains a lot of fructose. Fructose is the fruit sugar, and in fact, this is the most lipogenic sugar. Lipogenic means that it gets to the liver and turns to fat very quickly. So fructose turns to fat in the liver very, very quickly. It has a shortcut to turn into fat. So that's why fruit juice is not good for us. If you prepare orange juice, you how many oranges do you put in a orange juice? 4 or 5,
Yeah.
something like that at least. So imagine you have the sugar of 4 and 5 oranges. On the other hand, if you want to have fruit, it's fine because you have one orange, right? And you have it with all the fibers inside. So it's much better to eat an orange as a whole fruit rather than squeeze 5 at least to get a fruit juice. And then there's too much sugar into it.
Okay. I have some more general questions, but you reminded me of something else too, because just yesterday, somebody said they added honey to what they were eating, and they said, well, that's okay, it's natural. But so just comment about honey, because I know that's a pure sugar source, right?
It's not only sugar, it's mostly fructose again.
Yeah.
So it doesn't mean that you can't have honey, but you can have 1 teaspoon, let's say, per day if you want to have some sweet taste, it's fine. But don't get the wrong impression that because it's natural, you can eat it freely. It's not true because it's a lot of fructose. Again, it's like any other sugar.
Okay. Now, I wanted to also set realistic expectations for people. How long would it take for patients and let's say people know that they have MASLD or MASH, they're getting measured in on a fiber scan, for example, so they know what their steatosis score is, their fat score is. I was one of those. I about 2.5 years ago, I did it and I had 319 for this CAP score, CAP score, and which was horrible because that's over 70% fat. And it took a couple years and I got it down to 187, which is normal. So is 2 years realistic? I don't want to set expectations that people think that they can make these changes and like a month later they're going to have a normal score. So how long does it take for the liver to repair itself and to have normal numbers?
So it really depends on the amount of weight reduction. If you have a weight reduction of 5 to 10% of your initial body weight within, I don't know, 6 months, you can repeat the fibroscan within 6 months.
Okay.
And you will see a reduction in steatosis, most probably, but not necessarily a reduction in fibrosis, because fibrosis may take more time. You may see, but you may also not see. So usually we recommend to wait a year, but the main consideration is how much weight reduction was achieved. If you reach 7%, 10% weight reduction, most probably you will see improvements in both steatosis, the amount of fat you see, and fibrosis.
I think it's important and to note, and you just said it, that liver disease is still reversible when you have the scarring or the fibrosis, but if people wait too long and they become cirrhotic, that's not reversible. And so I guess, I mean, there are always the benefits of doing all of the things that you talked about, but it's really important to do it as early as possible too.
Exactly. I started my talk with the prevention,
Yeah.
and prevention is crucial, and it's the best thing you can do for your health is prevent liver disease or advanced liver disease. So yes, of course, we want to prevent advanced fibrosis, but it's also important to know that in the first stages of cirrhosis, when it's compensated, you can still sometimes reverse it or at least limit its progression. So if people have advanced fibrosis, don't give up. You still have a lot you can do to promote your health. So you still remember, in every stage of liver disease, there's a lot of dietary changes you can do to support your liver health.
And I wanted to end with this question, um, because MASLD and MASH are so related in a family, very often related to people that we live with. It could be partially environmental, cultural, the way they eat, or the habits that they have, or genetic. I mean, they're all related to those things. So, do you also recommend, and this is a tough one, but should people be trying to do some of this together with their family, maybe the spouse or kids or something, just to so that it's a sort of a group activity, or just do it on your own and worry about yourself? I'm just wondering your personal opinion on that.
It's an amazing point. I'm so happy you asked about it. First of all, we need support. And it's not only a support of professional, we need the support of our family. So many times I involve family members in the treatment because it's not just the diet of the person with liver disease that has to change, it's the diet of the entire house. It's what you buy, it's how you cook, it's how you have your family meals. Everybody should support and everybody benefits from it because healthy diet is good for everyone, right? So it's a pure benefit for the entire family. And yes, get the family involved and get their support.
Perfect. You shared so much today. Like I'm going to watch it again too, and I appreciate it. It's an amazing resource. Just the few minutes we spent together. Thank you so much, and I can't wait till the next time we have another opportunity to talk about this topic.
Me too. It was a pleasure. Thank you.